Hi, good afternoon, everybody. Now, we all know that generative AI has a big impact on our day-to-day lives. It's obvious. Everybody knows the day of the day what AI is, what it can do. But that means also that there is an importance, and actually a growing importance, in that human touch, in that human factor to oversee and to control AI and to make sure that AI is producing results that we can trust. Now, before we go deeper, I would like to ask you how much trust you have in AI. And please take your cell phone, go to slido.com, this is the code, and answer the question, would you rather have a hairdresser choose your next haircut or an AI system? Knowing that generative AI can be very, very creative. There are no limitations on the color, on the shape, on the cut. What would you do? Do you trust AI or an hairdresser? I think we can say that most of us still trust the hairdresser more. Let me provide you some context. Suppose that my generative AI system is trained on the most beautiful, hip and trendy haircuts of the last 3 years. And suppose that my human hairdresser is somebody like the women on this picture. For the Dutch here in the room, they will all know that person. So let me ask that same question to you again. Given that this is the hairdresser, given that my AI system is trained on the most beautiful haircuts, would you rather trust an AI system to choose your next haircut or a hairdresser? Well, we changed our minds. Okay, last question. Suppose that you have to make a choice who is doing your surgery. Would you prefer to have a doctor perform your surgery or an AI system? I'm already going to give you a hint. I have one here next to me, so please be careful what you answer. And I think, that's a nice introduction to my co-presenter. So I would like to welcome Davy van de Zande. He is an internalist at Erasmus Medical Center and a true pioneer for the use of AI in healthcare. And I don't have to tell you that trust in AI is very important for healthcare, right?
Definitely. Thank you for the nice words, Veronique. My name is Davy van de Zande, and I'm a clinical researcher in the intensive care department of the Erasmus Medical Center, our beautiful hospital, which you can see over here. And before we dive into the AI, I want to first, let's get back why we need innovation in healthcare in the first place. And that's why I brought a couple of headlines, which I collected through these years. And I know they're in Dutch, but the bottom line here is we have a serious problem. Our healthcare system was already in trouble before the outbreak of COVID-19. We were facing challenges like high workloads and personal shortages, and COVID even put more pressure on our healthcare system, actually. So if you're asking me, the real solution to these might be to innovate, and that's why I believe in AI. Speaking of which, where do we currently stand? I know there is a lot of buzz around AI, many people are talking about AI in healthcare, but this is the current situation. A lot of studies have been published over the past years, but most of them remain stuck in the development and prototyping phase. So this is one of the figures from a study we published lately. And on the y-axis, you can see the technology readiness levels presented over time, and you can see an exponential increase in the number of studies, but they all remain stuck in level 3, 4. And only a handful have been evaluated at the bedside. So it is not really impacting patient care as we speak. So an important barrier to actual implementation of AI is the gap, what we call between the bites and the bedside. On the one hand, we have our doctors, nurses, patients, and on the other side, we have our smart IT guys, let's say. But from experience, I can tell that we are really speaking a different language. And that's why I'm really proud that over the last 2 years, we managed to build the Data Hub, which is a physical place in our hospital where our nurses and doctors actually get to work with data scientists, cloud engineers, software engineers to try to actually push AI to the patient's bedside. But still, that is only a small step. The big questions remain like, how can we actually trust AI? And that's why I brought Emily today. Emily is a patient, 45-year-old patient, who presented to our emergency room with signs of a lung infection. And after carrying out several examinations, we went to ChatGPT and asked, should Emily be admitted to our ICU? Well, surprisingly, we got two completely different answers. First one saying, Emily should be immediately admitted, and the second one saying, well, not immediately. Emily's okay because she's responding well to her treatment, while I didn't give any contextual information. So that was a bit weird. So Veronique, please help me.
Yeah, so actually the general question is, how can we trust AI? What do we have to do to trust AI, knowing that AI cannot be trusted? And that's actually very simple because there are the components of which generative AI is composed, they are also not trustable. And why is that? Well, because the data that is used to train AI systems is not neutral. Data is, for example, biased. Now, don't point the finger to AI, because I just have proven with my little quiz that we're all biased here. I asked you, what do you prefer, a hairdresser or an AI system? And when I said that the hairdresser is somebody like the lady on the picture, we suddenly changed our minds. It looks like you don't trust ladies that are similar to that lady in the picture to decide on your haircut. So we're all biased. And the problem is, we are the creators of data, so the data is also biased. Second, the algorithms that are used to train our AI systems, they're also not neutral. Those seemingly mathematical, statistical, innocent algorithms, I will explain you, are not neutral. Same as the decisions that we make. And let me explain that you one by one. First of all, the data is not neutral. I actually don't have to tell you much about that, because I have just proven that the data that we create contains our human bias. And actually, just as with the GIGO principle, garbage in is garbage out, in AI, we have the BIBO principle. Bias in is bias out. If your data is biased, your AI system is biased. And that has some consequences, right, in healthcare?
Definitely. I think that has some serious consequences. We're already seeing that these biased data sets affecting our patient care. And I think one of the most shocking examples is this study conducted by Ziad Obermeyer et al. From the United States. And what they did is they examined an algorithm which was already deployed across the United States. And what they found is that Black patients were receiving 30% less care than they should receive, because the algorithm was targeting healthcare costs, because the data was biased, instead of severity of illness. And that's really scary. And we have other examples as well. For example, let's take this example from Nature Medicine. Also in imaging studies, we're seeing that the data used to train these algorithms does not represent all patients. Less than 3% of the data of the images used to train these classifiers originated from people with darker skin colors. So that's just really scary and emphasizes the importance of the human touch.
The human touch, exactly. Second issue that we have, the algorithms, they are not neutral. Those statistical mathematical algorithms, seemingly innocent, they're not neutral. And let me explain that to you, how that is possible. It's actually due to a human fallacy that we have. We have a human fallacy which is called hasty generalization, overgeneralization if you want, where we fail to distinguish between the universal truth and some exceptions. I think you can think of a couple of examples in your own life about this. Well, in AI, it's the same. What AI is trying to do, the algorithms, what they're trying to do is sketch patterns in data. So they're trying to find, as good as possible, a model that fits the data in the best way possible. We as data scientists, we are trained to find that optimal model. And what we really try to avoid is we try to avoid to create an overfitted model, meaning a model that reacts to the slightest variations in the data, to noise in the data, if you want. But on the other side of the spectrum, we have another risk, a risk of underfitting, a risk of overgeneralization. Yeah, because we try to find general patterns, but when we have an underfitted model, it means that we ignore specific patterns in the data, which is fine if it's noise and if it's outliers, because we want to find general patterns. But what if it's not noise or outliers? What if it's a minority group? And it's exactly those people that have unusual tastes, unusual behavior, unusual characteristics that are often mistreated by an AI system. And that's something that you are confronted with.
That's definitely something we're struggling with. If we look at...
Yeah.
Now, that's definitely something we're struggling with. If you're looking at the algorithms that are being published, we again see that poor generalizable algorithms underdiagnose minority groups. And I think...
Yeah, it's not there.
Oh, it's not there. No, it's no problem. And we see that these minority groups, which were already being underdiagnosed, I was about to show you an example of an X-ray study. Yes, that's the one. And those people that were always undertreated and underdiagnosed are again undertreated because of the algorithm is too often predicting that the patient is healthy while in fact the patient is not. And this occurs at the racial level, so black patients are again receiving less care than white patients, but also at the intersectional level, let's say Hispanic females are treated less, are getting less care than white male patients. So that's really worrying, you could say. Yeah.
Yeah. Let's go to the previous slide. Decisions are not neutral. That's the last point, why AI systems should need that human touch, why we should have extra oversight for AI systems. And that's because the decisions that we make are not neutral. Decisions that we make based on AI systems. And that's what we call interpretation bias. It's our fallacy, our human fallacy of incorrectly interpreting what the machine is trying to say to us. And I will give you a very simple example. What is your name? Tessa? All right. So suppose that Tessa here, she receives today from an AI system a probability. A 25% probability that today you will have a seizure, or maybe that today you will have a heart attack. A 25% probability. What does she have to do? Some will say, Tessa, go to the hospital, or please go to Davy because he can help you, because something will happen to you. Other people will say, Tessa, sit back and relax, enjoy the show because nothing will happen. 25% probability, come on, that's barely nothing. And that's the big issue today. We as humans, we are very bad in interpreting statistics in the correct way. And that's where you are confronted with every day,
Again,
right?
a problem. Yeah, definitely. I think it is really important to realize that the biases we have go beyond the algorithms itself. Just look at the way our medical decision-making looks like. Even if we have a fair algorithm, still we have clinician, patient, and other social factors that influence the way we are interpreting the outcomes, such as you gave Tessa. And finally, that can result in treatment bias. So it is really important to also take these contextual factors into account when you are evaluating your AI systems in the clinics. But unfortunately, we see that there is no standard practice yet, as we found in one of the studies we recently conducted, which is currently under review. So I think by now, you get a point. We still have a long way to go, and there are serious challenges and threats to safely and responsibly implement AI in the clinics. And that's why I'm just extremely proud to announce that we, over the last couple of months, together with SAS and Delft University of Technology, have launched the first responsible and ethical AI for healthcare lab, in which we proactively want to tackle these challenges. Together with SAS, of course, as our technical partner in this one.
Yeah, exactly. I think we have proven today that AI is not neutral just because the data, the algorithms and the decisions are not neutral. And of course, you need bright people like Davy to have that human touch. But of course, technology can help as well. All the problems that we mentioned today, we're working on that together with SAS technology. We have lots of capabilities to solve that. If you want to know more, there is a workshop Yeah, there is a workshop today about the more technical capabilities of SaaS and how we solve that for healthcare.
Okay, and to wrap our talk up, we would like to share this quote by a famous cardiologist and AI expert from the United States, Eric DePaul. I think it nicely summarizes what we've just discussed with you. The key idea of AI in healthcare is not making healthcare more efficient, but by preserving the most precious things we have in life, and that's the connections between humans. And that's, again, the human touch. And that's it.
Yeah.
Thank you for your time.
Thanks, guys. I think we have some time for some questions, but maybe a really quick one from me. We know that ethics and bias is a big problem, but as users of things like ChatGPT, are there any practical tips you can give to help us mitigate bias or be aware of it?
Making bias or
mitigating?
Mitigating. Yeah. I think the most important thing is always use your human intelligence when you work with artificial intelligence. The human part in it is indispensable. You really have to put your intelligence together with it, and then I think we can make a better world out of it.
Cool, thanks. Questions from the audience? We have one back there.
I was just curious, because as you mentioned, a lot of bias goes into these data and algorithms, which some might attribute to the creators of that data, of that bias. So then to what degree does a human touch help when they might have the same lack of diversity that is often found in the creators of those algorithms and of that data?
Yeah?
Yeah.
Would you? Well, great question. Also, difficult question, I think. And I think you made a very fair point. These biases occur at the deepest level of society, where our data is actually created. So if we go back to the example of the United States, this all has to do with the way we treated these patients for decades. So these patients had unequal access to care, and therefore they made less healthcare expenses. And now we're going to train algorithms, which like weird, to predict those healthcare costs. So to answer your question, it's like the deepest layers of our society, I would say. So of course, there is some sort of responsibility for the developers. They should be mindful when they are developing these algorithms. But as a society, we have a duty to tackle the bigger issues that cause these biases at the root. Yeah.
And I think that's also what we're trying to say. It's not only technology that will solve it, it's that human touch. It's actually creating teams that develop AI systems that are diverse, because only with diverse teams we can tackle those problems.
Thank you for your question.
Cool. One more question, maybe? Over here?
If I remember well, you said that you asked GPT twice the same question, you got two different answers. But that wasn't because of bias or overfitting, right? It's because of the way
The decision
the
bias.
way the engine works. So what do you do to train your users, doctors, to understand how the machine works? Because that's critical into how they have to interpret, what they should not do with it. So what do we do to train your users, not just the machine?
Again, really good question. I completely agree with you. The examples I showed you mainly had to do with trust. So how can we trust the system when it's generating two different responses for the same question? And I think it is our duty to train our doctors and nurses that are going to work with these devices. Okay, so what does it actually mean that I'm talking to an AI, so to say? And in the end, I think the bottom line is, in the end, we are all responsible for the clinical decisions we make. So it is not up to the AI. So we always need to be mindful of, okay, so what is the AI actually saying? And does it fit into the clinical context? Does it fit with my patient I'm seeing over here next to the computer I'm talking to? So I think, to answer your question, the biggest challenge is to train people to still be mindful, even though it's becoming more easy to go to ChatGPT and ask whatever you want. Yep.
All right. Thank you, guys.
Thank you.
Okay.